So for the session today, I am going to describe the suboccipital triangle. So am I audible and is the screen visible to you? Am I audible and is the screen visible? Okay. Yeah. So the topic which I am going to start with today is the suboccipital triangle. A small topic but a very useful topic for cracking the MCQs of anatomy. So myself, Dr. Monalisa. Before starting the session, just a few points about the Unacademy platform and myself. So about the plus subscription of the Unacademy. So if you wish to take the plus subscription of the Unacademy and you want to be the part of live class and sessions, so that's a good point. And the good point about, and you can say the positive point about the Unacademy platform is that always the live sessions are going on. You can be the part of any one of it. So many live sessions of all the subjects and structured courses either for the FMGE, INICT, NEET PG or Target Next 2022 batches are going on. So if you wish to take the plus subscription of Unacademy, you can use the code Dr. Lisa-YT for 10% discount. Live tests and quizzes are the key to success. So be the part of these sessions. Unlimited access is there. I know there is a busy schedule, academic workload, hospital duties, internship going on. So whenever you get time, you can see the sessions. You can be the part of live session. That is the best part. But if you are not being the part of live session, you can be the part of its session afterwards also, and it's no limitations. You can see the sessions 100 times also, no worry. And PDF notes will be provided to you. The iconic subscription, the merging of the Prep Ladder and the Unacademy. So you can be the part, you can take the good points and the benefits of both Prep Ladder and Academy. For this also you can use the code Dr. Lisa-YT is it's the code which can be accessed by you for 10% discount. You can unlock the Unacademy session. So any of the live session which you want to unlock, you want to be the part of any of the free live session. I'm talking about the free live sessions. So you can just use the code Dr. Lisa-YT and you can be the part of free live sessions. Now I would like to start with the topic of today's session, that is suboccipital triangle. The first thing which I want to tell you about the suboccipital triangle is its location, where it lies. So suboccipital triangle is a muscular space. It's a muscular space. And this space is lying deep to suboccipital region. It is lying deep to suboccipital region of neck. So what is important for your MCQ session is to know the boundaries of suboccipital triangle. You have to know the boundaries of suboccipital triangle. Okay, so many of the students has joined here. Good evening everyone. Okay, good evening everyone. So yes, welcome to the session. Now I would like to firstly tell you about the boundaries. So I would like to firstly explain about the boundaries. So here you can see the triangular space which is quite highlighted in this diagram, as you can see here. So the triangular space which is shown here in the diagram, I am talking about this triangular space. So I am just highlighting this triangular space with yellow color. So this triangular space which is highlighted here is the space which is lying in the occipital region, and you have to know about the boundaries. So it is bounded, as you can see, this suboccipital region is bounded supromedially by rectus capitis posterior major, inferiorly by obliquus capitis inferior muscle, and supralaterally by obliquus capitis superior muscle. So please write down the boundaries. After seeing the diagram, please write down the boundaries of suboccipital triangle. So write down the heading, boundaries of suboccipital triangle. The boundaries of suboccipital triangle is following. It is bounded supromedially by rectus capitis posterior major muscle. Also a part of rectus capitis posterior minor muscle will contribute. Suprolaterally, it is bounded by obliquus capitis superior muscle. Obliquus capitis superior muscle. And what about the inferior boundary? Inferiorly, it is bounded by obliquus. So, how you can remember? The inferior muscle is lying inferior, obliquus capitis inferior muscle is forming the inferior boundary of the suboccipital region. Okay. So, the boundaries about the suboccipital region has been asked so many times for the MCQ sessions in the NEET PG examination. So, please remember the boundaries of the suboccipital triangle. So, yes, yeah, hello everyone. Now, moving on to the roof. Okay, so the next point which I want to explain you is the roof of suboccipital triangle. So, what you can see, as you can see in this diagram, we have already explained the boundaries of suboccipital region. Here the same thing is shown with a 3 colors, and you know that this muscle is rectus capitis posterior major muscle. I am writing in short form. This is obliquus capitis superior muscle, obliquus capitis superior muscle, and this is obliquus capitis inferior muscle, which is forming the boundary inferiorly. So, this boundaries we have already done. Now, to approach the area of suboccipital triangle, what has to be removed? The roof structures, that is the skin and some muscles which is covering it. So, this roof is covered by a dense fibrous connective tissue overlying over the muscle, that is semispinalis capitis muscle. So, here you can see semispinalis capitis muscle, or also a part of splenius capitis. This muscle has to be dissected out, and then you can reach to the triangular space of suboccipital region. So, write down roof. The next heading is roof of suboccipital triangle. Roof of suboccipital triangle. The roof of suboccipital triangle is formed by dense fibrous tissue. It is formed by dense fibrous connective tissues which is lying over the muscle. Mainly the roof is formed by only one muscle, that is semispinalis capitis muscle. Now, moving on to the floor of suboccipital triangle. So, here is the diagram in which you can see the floor structures. So, in this diagram you can appreciate the floor of suboccipital triangle. So, the floor structures are posterior atlanto-occipital membrane, also the posterior arch of C1 cervical vertebra, that is the posterior arch of atlas cervical vertebra. So, these two structures is forming the floor of suboccipital triangle. So, please write down it also. So, I will firstly want to write you should write the floor. So, please write down the heading floor of suboccipital triangle. Floor of suboccipital triangle. The floor of suboccipital triangle is formed by two important structures. This is again important for your MCQ session. And this has been asked in an MCQ session for NEET PG examination, and the floor is formed by posterior arch of atlas cervical vertebrae and by posterior atlanto-occipital membrane. Posterior atlanto-occipital membrane. These two structures are forming the floor of suboccipital triangle. Now, The next one is to know the next important features, and which has been asked as an MCQ session, is the content. So this is the diagram in which you can appreciate the contents of suboccipital triangle. This is the diagram. So let me first show you the structures and then I will write the contents. So yes, you can see the roof structures has been dissected out, and the important contents here you can visualize the artery. So let me just highlight it more with the red color. Can you see this artery which I am highlighting with red color? This is the artery which I am talking about. This is the artery, and this artery is, this is which artery? This is the vertebral artery. So to be more specific, exactly the third part of vertebral artery is forming the content of suboccipital triangle. Other than that, we have also got suboccipital nerve plexus. Suboccipital nerve is an important content. Suboccipital nerve as shown in the diagram. This is actually suboccipital nerve is the dorsal ramus of the first cervical nerve. And also we have got suboccipital venous plexus. So write down the content. So the next topic is the content of suboccipital triangle. Content of suboccipital triangle. Contents of suboccipital triangle. The contents of suboccipital triangle is following. It is having suboccipital plexus of veins. Suboccipital plexus of veins lies there. It is also having greater occipital nerve, and one of the most important content here is dorsal ramus of first cervical nerve, and a specific term is given to dorsal ramus of first cervical nerve, and it is called as suboccipital nerve. It is called as suboccipital nerve. So please don't confuse with this. That dorsal ramus of first cervical nerve is given the name as suboccipital nerve, and the fourth content is, and the most important content is, third part of vertebral artery. To be more specific, it is the third part of vertebral artery. Third part of the vertebral artery. Now, again, this topic should not be missed out for cracking the MCQs of NEET PG examination. Content of suboccipital triangle. Now, I also would like to tell you that suboccipital venous plexus, how it is formed and what is the clinical importance of suboccipital plexus of veins. So, suboccipital plexus of veins are formed by suboccipital plexus of veins is formed by importantly following veins which is contributing together. So they are formed by deep cervical veins. They are also formed by contribution from the emissary veins. They are also formed by the communications with the internal vertebral venous plexus. Few of the muscular veins. Veins covering, so the veins around vertebral artery, also contribute in forming suboccipital venous plexus. So these are the few veins which is totally contributing to the suboccipital venous plexus. Now, if you want to know the clinical aspect related to the topic of suboccipital venous plexus, what happens? Actually, suboccipital venous plexus is forming a communication via emissary vein with the internal vertebral venous plexus. That means suboccipital venous plexus, which is located in the suboccipital region, is forming a common pathway, or you can say a route of infection being traversing from the external aspect to that of the interior aspect. So please write on this. Connection of suboccipital veins, connection of suboccipital veins, or you can say communication of suboccipital veins to internal vertebral venous plexus, is a potential, or you can say it's a pathway, it's a potential way or a pathway of spreading of infections. That means infections which is lying on the superior aspect, for example infection like carbuncles and all, can ultimately go intracranially. They can be in the form of intracranial infections. So superficial infections can form intracranial infections. This can form a mode of infection being transmitted to the internal aspect. I also want to explain, so one more thing which is clicking me, I just want to explain that. So just, okay, so yes, I just want to explain one more aspect, clinical aspect related to the topic, that is the Cisternpuncture. So generally when we want to go for CSF drainage for any clinical aspect, we go for lumbar puncture and all, but it is also a site which can be approached for taking the CSF, and in this case CSF is drained out, and CSF can be drained out either for therapeutic or for diagnostic purpose. So I just want to give you the landmark where the puncturing has to be done. Okay, so actually if you want to go for Cisternpuncture here at the level in the suboccipital region, so in the region of in the area of suboccipital triangle or the region, you have to approach in the midline. In the midline, just above the spine of, axis cervical vertebra, axis vertebra, that is axis means second cervical vertebra, C2, and then you can approach onto the posterior, you can pierce which membrane you will go and pierce. If you are approaching the Cisternpuncture at this level, you are going to puncture atlanto-occipital membrane, or atlanto-occipital membrane can be punctured. So I just want to tell you the depth of puncturing should not be more than, it should be less or equal to 2 inches, that is approximately 5 inches, that is approximately equal to 5 centimeters. Okay. Now, if you go further anterior, what will be the dangerous aspect? So, if you go further 1 centimeter anterior aspect also, what you can do, you can accidentally puncture medulla, because a very important part of brainstem, medulla is a very important part which is having respiratory centers, vital centers located in it. So you can puncture the medulla. So you have to not go deeper than 2 inches in the midline, just above the spine of axis cervical vertebra. So this was the small topic which I have just told you about all the important aspect of this triangle. And before just closing it, I just want to tell you that important aspect which has been asked so many times and which has to be kept in mind. You have to also refer these diagrams which I have given you. You have to refer the diagram for the contents. You have to refer this diagram for the floor, which all structure is forming the floor, which has been asked as an MCQ session. Floor structure, that is the posterior arch of C1, cervical vertebra and posterior atlanto-occipital membrane. The boundaries, the roof. So these are the topics which is important, and this will be asked as a NEET PG entrance exam MCQs. And also please refer this diagrams which will be helpful for you to crack the image based MCQs. Now before ending the session, few more points about the upcoming session. So I just want to tell you that my upcoming session tomorrow, I am going to take an upcoming sessions of free live session at 4:30 p.m. This session is just for 60 minutes. So if you want to be the part of this session, you can use the code Dr. Lisa-YT. So for unlocking the free plans of Unacademy, and if you wish to see any of the free sessions of Unacademy, just download the Unacademy app, search for the NEET PG as your goal, and just search for the free sessions of mine, that is Monalisa. You have to search for Monalisa. My name is Monalisa, and you have to use the code Dr. Lisa-YT for unlocking the free sessions of Unacademy platform. Now the last mile to crack the NEET PG 2021 approaching, coming near 18th April. Yeah. So for this you have to enroll. If you want to be away or stand out away from the crowd, you have to be the part of last minute revision sessions. The most important and highly probable MCQs of image based MCQ coming for the exam, different types of recapitulation of important topics, high-yield topics has been touched in all the sessions, and doubt clearing sessions is the part of key success, which is a very important and integral component of the Unacademy's part. enroll, if you want to enroll it, you have to take the plus subscription of Unacademy. And again, my dear friends, students, you can use the code Dr. Lisa-YT for 10% discount. If you was to, you will get 10% discount for the plus subscription of Unacademy. I would also like to tell you about the focus batch or FMGE session 2021. The batch highlights are subjects will be studied in detail, discussion of high-yield topics, covered all pattern of MCQs for the exam, and doubt clearing session along with the mentorships. Okay, so generally the faculties and the educators of Unacademy are very helpful. They will absolutely be helpful in cracking the examination and clearing all your doubts. Enrolls. If you want to enroll, again you can use the code Dr. Lisa-YT for 10% discount. Now, before ending the session, just how to approach the Unacademy platform. Download the Unacademy app. Find NEET PG as your goal. If you want to be the part of Unacademy platform, you want to be the live classes, free session, you have to use the code Dr. Lisa-YT. If you want to take the plus subscription also, you have to use this code. You can also be the part of the Telegram group of Unacademy, where all the 19 subject sessions is going on, and you can be the part of any one of it. I also want to tell you that my own Telegram group name is Monalisa Anatomy. So you can just search for the Telegram. You can just search on the Telegram Monalisa Anatomy, and you can be the part of Monalisa Anatomy group. In this, you can ask your doubts related to Unacademy, how to approach for Unacademy, or anatomy MCQs, or any doubt related to your preparation, and all the links of my free session link. Also, the PDF is provided in this group, so you can be the part of this group if you wish. Okay, and also I want to tell you about, before ending the session, I want to tell you that you just use the code Dr. Lisa-YT, because tomorrow 4:30 to that of 5:30 p.m. I am going to take a free live session on the Unacademy platform. So you have to download the Unacademy app. You have to, the link will be shared in the group of either my own group if you join, that is Monalisa Anatomy, or the Telegram group of Unacademy. You can join my group on the Facebook, that is Dr. Monalisa Anatomy, Telegram group Monalisa Anatomy. You can be the part of the session. You can also be the part of my own session, that is the NEET for the next preparation. I am taking a session. My classes will be in April, but the session is already started. You can use the code Dr. Lisa-YT for 10% discount. Now, before ending the session, I just want to tell you, that okay, I just want to tell you about the combat sessions, which is also going to be taken on the Unacademy platform. So tomorrow there is a fun session about that. Be a part of focus batch of FMGE 21 or NEET PG, and those who wish to join my own group. So once again, I have just give the information of my own group link. Monalisa Anatomy. Tomorrow free session is from 4:30 to 5:30. You can use the code Dr. Lisa-YT for unlocking the free session. All the best. Keep studying. Thank you so much, students. Thank you so much. We will meet again with the new sessions coming on in the Tuesday, say in the same time, 9 p.m. Tuesday. Thank you so much. All the best.